Cryptococcus is a disseminated infection that can occur in AIDS patients. Usually the dissemination infection occurs in AIDS patients. If not, it's just mild and sometimes the patient will not notice it. So cryptococcosis is due to Cryptococcus neoformans. Is a fungi, encapsulated fungi with 5 to 10 micrometers of budding. The classical appearance of Cryptococcus neoformans is that if we see it in India ink, we will see a halo. We will just see the capsule and a clear halo. And if we stain it with muscirhamine, we reveal a red capsule. Now the antigen for Cryptococcus neoformans is the most sensitive and specific. The antigen. So we will do the diagnosis. The transmission is due to ingestion of let's say products of pigeon, and obviously that the patient be immunocompromised, because a immunocompromised patient usually would not notice this. Now the disseminated cryptococcosis that is in AIDS patients, the most common presentation of a disseminated cryptococcosis is in the skin. So how would we notice this in the skin? We will notice it as multiple discrete flesh to red colored lesions with slightly central umbilication. Slightly. This is the clinical presentation. Now the treatment is amphotericin B plus flucytosine for 2 weeks. After that, if the patient is getting better, we discontinue these 2 medications and we give 8 weeks of ketoconazole. Sorry, what am I saying? Of fluconazole. And this is the consolidation phase. And then not prophylaxis, but daily medication for up to 1 year until the CD4 count be greater than 100 cells per cube millimeter. And the fluconazole would be given to a lower doses. The presentation of Cryptococcus neoformans could also be encephalitis, meningitis, etc. In meningitis, remember that we would see decreased glucose because it's a fungi, increased opening pressure, leukocyte count, elevated leukocyte count in the cephalospinal fluid, with predominance of monocytes. And sometimes the patient needs serial lumbar puncture due to the elevated opening pressure or a shunt in the ventricles. Alright, so Cryptococcus neoformans is a opportunistic infection associated with HIV and pigeon. The diagnosis, the most sensitive and specific, is the antigen for the Cryptococcus neoformans, but we can also visualize it in India ink or muscirhamine. The treatment is amphotericin B plus flucytosine for 2 weeks, next fluconazole for 8 weeks, the consolidation phase, and next the fluconazole to a lower doses until 1 year, and CD4 count return to more than 100 cells per cubic millimeter. The disseminated presentation will be flesh to red discrete lesions with slightly central umbilication.